Hi everyone, welcome to East Tennessee and Company. I'm Sherry Ayler. You may have heard that diabetes causes eye problems and may lead to blindness. People with diabetes do have a higher risk of blindness than people without. But most diabetics only experience minor eye disorders. And if you do develop a major problem, there are treatments that work well if you begin them right away. Joining us today is Dr. Kirk Haun from Campbell Cunningham and Taylor to explain more about the diabetic eye and care for it. Thank you for joining us today, Dr. Haun.
Thank you very much.
Well, tell me, what are some of the warning signs that go along with this issue or different issues concerning diabetes with the eye?
Generally, some of the warning signs that we see are overall just kind of blurred vision or decreased vision that people may notice. They also can notice floaters or spots in their vision that they haven't had before. As well as some symptoms of glare or difficulty with lights. Unfortunately, there are changes with diabetes that can occur that early on people don't have any symptoms with.
Well, what are some of the most common complications that they experience, and what treatments are available to go along or treat those complications?
Certainly. In diabetics, we do find that diabetics get cataract changes earlier than non-diabetics, and these cataracts actually progress more rapidly in diabetics as well. Cataracts can be treated early on with glasses or sunglasses to help with improving the vision and decreasing glare symptoms with lights. If the cataracts become more problematic, then you can move forward with cataract surgery or removing the cataracts to improve the vision.
What about retinopathy? That sounds really serious. What is it, and what are the contributing factors to that?
Yes, diabetic retinopathy is one of the concerns that we have with diabetes, and what that involves is that the eye has blood vessels in the back of the eye, and those blood vessels are affected by diabetes and can cause bleeding and swelling. The bleeding and swelling that can occur can take vision or threaten the vision over the long term. That oftentimes can be treated with laser treatment and sometimes with medications. And the
contributing factors again are?
Contributing factors to the diabetic retinopathy, first of all, will be blood sugar control, which is very important. The better the blood sugar control, the less the risk of the diabetic retinopathy. Controlling things like high blood pressure as well as cholesterol control is very helpful.
Does this affect the young and old alike?
It affects the young and the old. Again, the risk factors really involve how long the patient has had diabetes. So if you have diabetes at a very young age, you may still be young even though you've had diabetes for a significant amount of time. It is more common to have diabetic retinopathy as we get older, certainly.
Well, I know it sounds like I'm repeating myself, but what can people do that do have diabetes in order to avoid getting eye problems starting, early on in life and obviously as they age?
Certainly. The first will be, again, controlling the blood sugar, controlling high blood pressure, controlling cholesterol as well. Not smoking is helpful. And really, very importantly, is getting regular eye checkups, particularly with diabetes. If you are over 30 years old and have been diagnosed with diabetes, you should have a diabetic eye exam on a yearly basis, again, to check for changes. We do know that if you have changes from diabetes, such as diabetic retinopathy, if we can intervene early before the vision is greatly affected, we actually do better than if we're trying to come in after the fact. After the vision's already gone down, we don't do as well with the treatment. Younger diabetics under the age of 30, if they've had it for over 5 years, should also have an exam about every year.
Well, thank you, Dr. Haun, for joining us today and explaining this information that the community really needs to know about. And for more information about diabetic eye care or to schedule an appointment, call Campbell Cunningham and Taylor at 584-0905 or visit ccteyes.com. You can get all this information at our website, East Tennessee and Company. And we want to thank you again for joining us. We want to thank Campbell Cunningham and Taylor for sponsoring today's program and bringing you this important information. Come see us again next time. Have a great day.